In this video, we explore the life and contributions of Abu al-Qasim al-Zahrawi, the father of modern surgery. His groundbreaking work not only changed the course of Islamic medicine, but also laid the foundation for surgical practices used today. Our story begins in the year 936 CE in the city of Madinat al-Zahra, near Cordoba, Spain. This was a time when the Islamic world was at its intellectual peak, preserving and expanding knowledge from Greek, Roman, and Persian civilizations. From an early age, al-Zahrawi showed immense interest in medicine. He studied under the finest scholars in Al-Andalus and mastered subjects like pharmacology, anatomy, and surgery. Unlike many physicians of his time, he believed that medical knowledge should not only be preserved, but improved upon. This passion led him to write one of the most important medical encyclopedias in history, Al-Tasrif. Al-Tasrif was a 30-volume medical encyclopedia that covered a wide range of medical topics, from general medicine to surgery, dentistry, and pharmacology. But the most groundbreaking part was the final volume, Kitab al-Jarrah, the Book of Surgery. For the first time in history, surgical instruments were systematically catalogued and illustrated. This was a game-changer for future surgeons. Centuries later, European physicians translated Al-Tasrif into Latin, and it became a standard medical reference in universities across Europe for 500 years. Al-Zahrawi didn't just write about surgery, he revolutionized it. Let's look at some of his greatest medical innovations that are still relevant today. 1. Catgut sutures. Al-Zahrawi was the first to use catgut sutures, a natural thread made from animal intestines, to close surgical wounds. These sutures dissolved naturally, preventing infections and reducing the need for additional surgery. 2. Surgical instruments. He designed over 200 surgical instruments, including forceps, scalpels, and retractors, many of which are still used today. 3. Cauterization technique. He introduced cauterization, a method where wounds are burned with a heated instrument to stop excessive bleeding. This method is still used in modern surgeries. 4. Hemophilia diagnosis. He was the first to describe hemophilia, a genetic disorder where blood doesn't clot properly. This early observation led to modern research in hematology. 5. Use of cotton in surgery. Believe it or not, Al-Zahrawi was the first to use cotton in surgical procedures to control bleeding, a simple yet revolutionary idea. Al-Zahrawi's work didn't just influence Islamic medicine, it transformed medical practices worldwide. His book Al-Tasrif was used in European universities from the 12th to the 17th century. Famous European physicians like Guy de Chauliac openly acknowledged his work and called him the leading authority in surgery. Even today, many of his methods and instruments are used in modern surgical procedures, proving that his contributions were far ahead of his time. Al-Zahrawi's dedication to medicine and surgery changed the world. His story reminds us that knowledge has no boundaries, and the pursuit of science and innovation is timeless. Islamic scholars made countless contributions to science, medicine, and technology. If you'd like to hear more about these pioneers, comment below and let us know.